November is COPD Awareness Month. What is COPD? COPD is an abbreviation for Chronic Obstructive Pulmonary Disease. Chronic refers to long-lasting or recurring. Obstructive refers to a blockage. Pulmonary disease refers to a disease or disorder of the lungs. COPD is an inflammatory disease of the lungs that causes damage to the lungs, leading to the blockage of airflow and difficulty breathing. How common is COPD? COPD is the third leading cause of death in the United States, or fourth leading cause depending on the year and what you read. According to the CDC, in the United States, in 2018, COPD was diagnosed in almost 16 million people. It affects both men and women, with women having a higher prevalence of death. It usually presents at about age 40, but increases with advanced age. It is more common in people who smoke or are former smokers, and also in people with a history of asthma. The two most common types of COPD are emphysema and chronic bronchitis. Signs and symptoms of COPD can include shortness of breath, wheezing, a smoker's cough or constant cough, excessive mucus or sputum production, frequent respiratory infections, cyanosis, which is a bluish discoloration of the lips or fingertips, inability to take a deep breath, and fatigue or lack of energy. How is COPD diagnosed? First, your doctor will take into account your signs and symptoms, then a simple breathing test called a spirometry test, which measures lung function and breathing issues, will be done. Also, a chest x-ray. Complications or effects of COPD. These can include fatigue, decreased ability to work, the need for supplemental oxygen, decreased health status, increased depression or other mental health conditions, activity limitations due to difficulty walking or climbing stairs from fatigue, social isolation, increased confusion or memory loss due to decreased oxygen, and increased hospital visits. Treatment for COPD includes medications such as inhalers, supplemental oxygen, and pulmonary rehabilitation. Can COPD be cured? Unfortunately, no, but it can be managed. To help prevent or limit the effects of COPD, if smoking is the cause, first, stop smoking. Avoid secondhand smoke. Avoid chemical or air pollutants. Avoid and prevent lung infections, such as receiving the flu and pneumococcal vaccines. Exercise regularly, if tolerated. This can keep the lungs healthy and strong. Remember, stay healthy, don't smoke, get regular exercise, eat a healthy diet, and see your doctor regularly. You can find me on YouTube, Instagram, TikTok, Facebook, Twitter, Pinterest, and on my website, www.nursemastercharlie.com. To learn more on the go, you can find my COPD song on Apple Music, Spotify, iHeartRadio, Pandora, Deezer, YouTube Music, and all music streaming platforms. I am Nurse Master Charlie.
COPD is an inflammatory disease that blocks airflow out of the lungs. The two most common type are chronic bronchitis and emphysema. It's the third leading cause of death in the United States. Environmental pollution and cigarette smoking increase these rates. It usually occurs in men.